We're back with Donna Sceviour with Sceviour on Dentistry.
Donna, what are some of the revenue opportunities that are commonly missed by dentists, and how can these revenue streams be enhanced?
That's a super good question, Ken. I'm going to mention something that people don't think of all the time because they're always looking at things to bring something else in their practice that's going to increase their revenue opportunities. Their biggest revenue opportunity is their practice management software. The reason for this is people use it to about 25 to 30% of its capability for tracking treatment that hasn't gotten done and patients who could be called, recare patients that have sort of fallen out of the loop that need that extra nudge to come back and be invited back to the practice and have those type of things take place. How many implants you've done, how many people who went for an implant consult but actually never booked the procedure. People really could increase their revenue by conservatively 10% if they use their practice management, even 25% more than they're currently using now.
That is huge.
It is huge, and they've already paid for it. They own it. It's really that simple. Another revenue missed opportunities by dentists is that never properly training their hygienists for co-diagnosis and treatment planning, and how to follow up with patient care, and how to set up a soft tissue management program within the office to do scaling of root planings, and when do patients finally get referred out of the office? I find in a lot of practices, patients are referred out far too quickly than they need to be.
Donna, the economy's really been tough on a lot of us. How has it affected the dental industry, and also, have some regions of the country been more affected than others?
Yeah, that's funny. I think we all enjoyed a few years there that I said everybody was pretty much successful in spite of themselves. We didn't have to be good coders or good bookkeepers or good trackers as far as making sure our patients came back and forth because we were busy enough and we were making money and sort of being successful without that. When the economy adjusted, several things took into place. The first thing I always recommend to a practice that they have 6 months in an account that if there was a little dip in the economy that they could accommodate for that. Pretty much most practices live to a week-to-week or a month-to-month basis. So if you have something that dips longer than 3 months, any practice who falls under those guidelines are definitely in trouble. I think California extremely hard hit. They do a lot of cosmetic dentistry, and the first thing that stopped for discretionary funds were things that were elective. That was problematic. But then in some other regions, in Boston, which is like a conservative area, we actually saw it was a 27% increase in implants last year. And people are saying, why is that? Because now people are being educated that that's a viable option for tooth replacement rather than just the old option of a 3-unit or a 4-unit bridge. People are now taking advantage of it. So I think people now are starting to come full circle. They've honed their treatment planning skills. They're talking the talk that they probably should have been doing and paying attention to some things sooner than later. Many practices complained I've had to reduce my hygienist to part-time hours, but that again, cut your nose to spite your face, that's where all your treatment comes from. So some of the new patient things that we talked about earlier, that would have been great time to, if that was downtime for the hygienist, get them into a preschool or a school system, start increasing that new patient flow. A hygienist is just as powerful behind the scale or behind the chair as she is behind a podium and talking to people, getting them excited about the practice.
So in other words, taking advantage of those missed opportunities we discussed in the last question, being able to hone the skills to acquire those revenue enhancements can really make the difference in a down economy like this.
Right. You always joke. I think, a lot of husbands and wives tease each other. Either we have enough money and not enough time, and we have the money. Same thing applies to business. So that's the time you re-educate yourself, you grow your business. I mean, you have to do it carefully so you don't put yourself in a hole, but those are the times you reinvest into your systems and things that gets them to be that next step, that your practice differentiates from other practices in the area, that what do you offer more than anyone else. The first mistake, I think it's the number one mistake that every practice makes, is the first thing they stop is marketing in a slow economy. It should be almost the last.
When a dental practice has been sold, the transition period can be quite hectic and stressful for the new owner as well as the staff. What ways can the stress be minimized during the first few months of operation?
Geez, I'm glad you asked this question because I get this one all the time, Ken. The first thing that needs to happen is before the sale of the practice. It's like a marriage when a doctor decides, or doctors, if it's a team, decide that they're going to retire and pass the baton to another practitioner. it's really, really important to have the rules of engagement outlined and thoroughly. A lot of times they're like, okay, I'm going to get the chairs, the digital radiography, 2,500 patients, and the real estate, and good luck, I'll be here for 2 months, and here we go. That's really not a good transition. Most actually transitions that work better is actually when the doctor actually does retire on the day of the sale. But in some instances, they want to be still part of the practice, and that can work out too. But if you don't understand how patients set up a system, how patients get transitioned, how staff members now report who's the boss. If a staff member has a concern, who does he or she speak to? If there's a case of someone wants a pay increase, do other rules of engagement the same? If you outline and people know where to go and how to do it, you're really going to minimize a lot of the stress and consternation that happens in these type of transitions. What stresses people out is the unknown, the fear of what they don't know. And if you put those rules and systems into place, it's pretty straightforward. And it usually takes about 2 meetings on average for a reasonable sale for the current owner and the future owner to sit down and outline those things and how they're going to execute them. Because, again, it's leadership down, Ken, and they have to show how they are working with each other and how they're making, if a compromise needs to take place or a decision, and how that system works, and that's how it relates down to the team, and the team needs to be educated. Okay, as of April 1st, this is the way we're going to be doing things now. I want to introduce Dr. So-and-so, amazing clinician. I brought him in because I'm very confident that he or she is the best choice for this practice, and I know you're going to give he or she their full support, and this is how we're going to do that. And that's a great way.
Do you find that sometimes it's advisable for, let's say if a person's been an associate at a different firm, they're buying a new practice, is it advisable for them to maybe work in that practice they plan to acquire for a few months to kind of get a feel for how that practice operates?
Absolutely. No one gets married usually unless they're in Vegas on the first date. So you definitely should do that, because you know what? Everything looks great on paper. You may find out, you know what? I'm a minimalist. I like things very stark and empty, and someone else may be into technology and things, and the more things, the better. That kind of relationship may not last.
Okay, well, Donna, what's the best way for a potential client to get in touch with you?
2 ways to get in touch with me, Ken. The best way to get in touch with me is my email. I really do focus on only a couple practices at a time, and they get my full attention. The importance of that is I like to see something through and resolve. So the best way that they can get me is my email, and that's SceviourOnDentistry@gmail.com, or they can reach me by my office number, which is 617-549-1281.
Well, Donna, I learn something new from you every time we talk, and I sure appreciate you taking the time to share your valuable insight and wisdom with our listeners.
Thank you so much, Ken, and again, thank you for the opportunity. You're doing a great thing for dentistry.
All right. Well, thank you for joining us today. The Dental Expert Advisory Series is an effort to provide valuable information and tips to running a more efficient and profitable practice. Tune in next time when we interview another dental industry professional. Check out our website, dentalpracticecash.com, for all your practice financing needs. We offer equipment leasing, working capital loans, funds for remodeling and expansion, as well as practice acquisition financing. That's dentalpracticecash.com.